Medicare sometimes doesn't make any sense in what it covers and what it doesn't cover. But let's first start talking about what it does cover. See, when someone asks what original Medicare will cover, here's a good response. If it's medically necessary, Medicare will cover it. See, now there are some things that Medicare will not cover that we will go over in the next section, so be sure to watch that video. To be a Medicare expert means that you must fully understand the foundation of Medicare so that you can keep this simple and easy to understand. Remember, our goal is to keep this simple as 1, 2, 3. Let's talk about the Medicare Part A hospital coverage. So Part A we've talked about before is the hospital side of Medicare. So think of this as the room and board when you're admitted into the hospital. It'll cover a semi-private room. It'll cover a private room if it's medically necessary, the meals, the nursing, the drugs as part of the stay, and other hospital service and supplies. The individual will get the treatment and coverage they need if they find themselves admitted to the hospital under the Medicare Part A. If someone needs blood infusion which has not been donated and the hospital needs to buy the blood for them, the individual will be responsible for the first 3 pints during that calendar year. The Medicare Part A will pick up the cost after the first 3 pints of blood. Here's some good news. Most Medigap supplement plans on the market will actually step in and pay for the first 3 pints of blood for that individual, leaving that person with no out-of-pocket cost for any blood infusions with the Medicare Part A. Let's get really familiar with the Part A and the 4 things that it covers. We talked about this in a previous video. There are 4 primary things that we're going to discuss right now that Medicare Part A are going to cover. It's going to cover hospital inpatient care, skilled nursing facility care, home health care, and finally, hospice care. Let's talk about the hospital inpatient care. It is important to understand when thinking in terms of an inpatient hospital, the average stay in a hospital in the United States is around 4.5 days. See, once someone's admitted to the hospital, they will have a deductible that will be their responsibility. That deductible for the Part A in 2021, we went over earlier, is $1,484. Now that deductible does change a little bit every single year. Medicare Part A will cover everything for the individual's inpatient hospital stay for up to 60 consecutive days, except for that small $1,484 deductible. Hospitals are not going to keep someone in the inpatient hospital setting for 60 consecutive days normally in today's world. The days of being in the hospital as an inpatient for a long period of time are kind of a thing of the past because of cost and the need for those hospital beds. Here's something to keep in mind about the Part A deductible. The key to remember about Part A is that $1,484 deductible is unique to Medicare because it's a benefit period deductible. See, most all insurance deductibles are annual deductibles because they cover all aspects of the health care. Medicare Part A is different because it only focuses on that one thing, the hospital. See, the Part A deductible is good for 60 days starting from the day someone's actually admitted. If someone were to be admitted for, let's say, 4.5 days, which is the average, and then they were discharged, then they would be responsible for that $1,484 deductible. Here's some good news though. If someone were admitted, again, any time during those 60 benefit days, they would not be responsible for that $1,484 deductible again because it was within that 60-day benefit period. Here's a question that we get when it comes to the Part A deductible. What if an individual was in the hospital for more than 60 consecutive days? What would happen? In order to be a Medicare expert, let's break this down so that you fully understand it. From days 1 through 60, there's a $1,484 deductible that covers you for that benefit period. Now, if someone were in the hospital for more than 60 days, on day 61, there's a $371 per day charge from day 61 to day 90. Now, if someone found themselves in the hospital for more than 90 consecutive days, on day 91, there's a $742 a day charge each day with a 60-day lifetime reserve. Let's talk about the 60-day lifetime reserve because a lot of people don't understand how the lifetime reserve actually works. Here's how the coinsurance of $742 per day of the lifetime reserve days actually work. So if someone found themselves admitted to the hospital for, say, 90 days, on day 91, Medicare would give that individual an additional 60 days in their lifetime that they could actually use. Let's give an example. the individual in the hospital as an inpatient for 100 consecutive days and then discharged, they would have used 10 lifetime reserve days. In that example, it would leave that individual with 50 days of lifetime reserve days since they only used 10 days of that 60-day allotment. See, if the same individual found themselves admitted again into the hospital for more than 90 consecutive days, they would, in this example, have 50 days of lifetime reserve left that they could actually use. If those 50 days were used, unfortunately, that individual in this example would be responsible for all the costs. Here's some good news when it comes to the Part A hospital costs. A Medigap supplement plan can add an additional 365 days. See, it's extremely rare and unlikely that any scenario would have someone admitted to the hospital for actually 60 consecutive days. But to be fully prepared for any scenario under the current rules, Part A will provide some coverage to anyone admitted to the hospital for almost a full consecutive 5 months. After those 5 months admitted to the hospital, the individual would be responsible for all costs. Remember, you have 90 consecutive days and then you have 60 lifetime reserve days, so that would be 5 months. Here is where a Medigap supplement plan would provide incredible coverage. A Medigap supplement plan will cover the Part A deductible and the per day coinsurance, including those lifetime reserve days. So that individual would have no out-of-pocket expenses under the Part A for a full consecutive 5 months. Here's the additional good news. If the individual found themselves admitted to the hospital for more than 5 consecutive months, the Medigap supplement plan will step in and pay for an additional 365 days. That means that theoretically, someone could be admitted to the hospital for almost a full 17 months, completely paid for by Medicare Part A and the Medigap supplement company. Let's talk about the skilled nursing facility because that falls under the Part A hospital. It's important to understand when thinking in terms of a skilled nursing facility care that the average stay in a facility is around 28 days. A skilled nursing facility is an inpatient rehabilitation facility that's intended for short term. See, it's designed to help someone recover from an inpatient hospital surgery or a chronic condition that will still require 24-hour care for that actual individual. An important distinction to make, and something that confuses a lot of individuals, is that a skilled nursing facility is not a nursing home. See, many individuals will confuse a skilled nursing facility with a nursing home. A nursing home is for long-term residential care, which is very, very different. What makes things sometimes really confusing, and it just doesn't make any sense, is there are some nursing homes that do also have a section that's used for a skilled nursing facility. We're going to discuss this more in depth in the next section, but Medicare will not cover care in a residential nursing home because that's not intended for short-term care. A skilled nursing facility is covered by Medicare Part A because it's used for a limited number of days and not for long-term care. Think of a skilled nursing facility as an extension for someone's inpatient hospital stay. Here's a very easy way to think in terms of a skilled nursing facility. Think of it as a pit stop. The pit stop is between the hospital and someone's home. See, it's designed to get the individual the skilled care that they still need in the form of nursing and therapy in order to get them back on their feet and back to their house. A skilled nursing facility will have licensed nurses, physical and occupational therapists, as well as those specializing in speech and hearing. A speech or hearing specialist might be needed for someone, for example, that might have had a stroke. Now that we've talked about a skilled nursing facility, let's talk about the distinction between admitted versus observation. This is a really big deal. Knowing the difference between admitted versus under observation is very important when discussing the hospital stay. See, Medicare currently requires that someone be admitted as an inpatient to the hospital for 3 days in order to be covered by Part A in a skilled nursing facility. Here's why knowing the difference between admitted versus under observation is so important when it comes to understanding which part of Medicare it's actually going to fall under. When an individual is admitted to the hospital, it's going to fall under your Part A. You were admitted to the hospital. If the individual is placed under observation in that same hospital, it will fall under Part B. Here's a big problem that you need to understand. At the present time currently, Medicare will only cover an individual skilled nursing facility under Part A, which means that they must have been admitted to that hospital. Here's a big problem. At the present time, in July of 2021, Medicare will only cover an individual skilled nursing facility under Part A, which means that they must have been admitted to the hospital. This is such a big deal that we wrote an article for Forbes talking about the difference between admitted and under observation and how that impacts someone's skilled nursing facility. So let's talk about what goes into how that status is actually determined. There are guidelines that the hospital must follow that are outlined by Medicare as to what status the individual will fall under when they actually arrive to the hospital. Let's make this really easy to understand. The guidelines set forth by Medicare outline that the status of admitted is viewed as a serious condition and the under observation is viewed as not a serious condition. It sounds really simple, but there's much more that goes into determining the status. See, when someone is under observation, the hospital has determined that that condition will not require the need for care longer than 48 hours. Someone could arrive at the hospital and be initially under observation, but then later determine that it's actually much more serious and could be placed as admitted to the hospital. It's really important to see how this all works with the skilled nursing facility because skilled nursing facility has what's called a 3-day rule. At the present time in July 2021, for Medicare to cover any part of a skilled nursing facility, this is really important, the individual must have been admitted, which is serious, to the hospital, and that individual must also have been admitted to the hospital for a minimum of 3 days. We call this the 3-day rule. Due to the nature of how this could affect which part of Medicare is billed for services, hospitals are required at present time to disclose to someone if they've been admitted or if they're under observation. Unfortunately, a lot of individuals don't know the difference between both things because they are actually in the hospital. If someone's been admitted and met the requirement of the 3-day rule, they will be eligible for a skilled nursing facility coverage under Medicare Part A. Currently, as of July 2021, Medicare Part A will provide 20 days at no cost to that individual for a skilled nursing facility care. What if someone needs longer than 20 days in a skilled nursing facility? Here's what would happen if someone needed to be in a skilled nursing facility for longer than 20 days that Medicare provides under Part A at no cost. So the first 20 days in a skilled nursing facility is covered at 100% by Medicare. For days 21 through 100, Medicare will cover all costs at a skilled nursing facility except for $185.50 per day charge as of 2021. So for an individual past 20 days on day 21, there's a $185.50 charge per day that they would be responsible for. If anyone is in a skilled nursing facility for more than 100 days on day 101 and beyond, unfortunately, that individual is responsible for all costs. Here's some good news for those that have a Medigap supplement plan. The $185.50 per day would actually be covered by the Medigap supplement company for days 21 through 100. This would give someone a little more than 3 full months of coverage of not having to worry about any out-of-pocket costs for that skilled nursing facility. Remember, the skilled nursing facility is designed for short-term care, and we discussed earlier that the average stay in a skilled nursing facility is 28 days. So with Medicare and a Medigap supplement plan, that individual would get a full 100 days at no cost because it's covered by Medicare as well as by the Medigap supplement company. Home health care falls under Part A. It's important to understand when thinking in terms of home health care that the average length of care for services is around 41.5 days right now. Here's some good news though when it comes to how home health care is covered by Medicare. Medicare will cover all costs under either Medicare Part A or Part B if someone is determined that they are homebound, which means that it'll be very difficult leaving their home and needing skilled care. See, for Medicare Part A to cover someone's home health care at no cost, they must have been admitted to the hospital for at least 3 consecutive days and needing home health care treatment within 14 days of being discharged from the hospital or skilled nursing facility. Let's discuss how home health care is covered under Medicare Part A. Medicare Part A will cover the home health care at no cost to the individual for the first 100 days if they're needing services within 14 days of being discharged from a hospital or a skilled nursing facility. You see, Medicare Part A will cover home health care under what they consider part-time or intermittent skilled nursing care. Skilled care will include things like physical therapy, occupational therapy, speech therapy, etc., that are coordinating between the patient's doctor and a certified home health care agency. Here's something to be aware of when it comes to home health care. Medicare Part A or B will not cover home health care if it's considered personal care for things like 24-hour daycare at home or meal delivery. Medicare will also consider things like shopping, cleaning, laundry, bathing, dressing, or using the bathroom as personal care when that is the only thing that the individual is actually needing. Home health care must always be predictable and have an ending point for it to be covered under either Medicare Part A or Part B. Here's some good news about home health care. It can be covered under Part B. See, if the individual is still needing the services of home health care for more than 100 days after being discharged from the hospital or skilled nursing facility, it will automatically be covered under Part B. Medicare Part B will cover all costs, and that person would not be responsible for the deductible or any co-insurance. Home health care is different than the rules of a skilled nursing facility. Medicare Part B can still cover all costs for an individual without them having to meet the inpatient 3-day hospital stay requirement, which is huge. Here's the requirement for home health care under Part A or Part B. The doctor must feel the individual must be homebound and will need the part-time services of a skilled nursing care at their home. Secondly, the patient's doctor must be the one to order the home health care services and prescribe a plan of treatment. The doctor must certify that that individual is actually homebound and it'll be too difficult to leave their home for treatment. Lastly, the doctor will then coordinate the care with a certified home health care agency approved by Medicare, and the patient's doctor must review that plan every 60 days. See, home health care is for part-time or intermittent skilled care or therapy of usually 2 to 3 visits a week. If someone requires full-time nursing care, Medicare will not approve the home health care. Remember, the home health care must be predictable and it must have an ending point to it. If an individual needs durable medical equipment when they're receiving home health care services, it will fall under the medical side, which is Part B. See, Medicare does not cover all the cost of durable medical equipment. The individual would still be responsible for 20% of any durable medical equipment used during their home health care services. Here are some commonly prescribed durable medical equipment that's used during home health care. Sometimes it's walkers, crutches, wheelchairs, a home hospital bed, oxygen equipment, nebulizers are used a lot of times. Sometimes there are scooters that are involved. A CPAP machine is sometimes used. Blood sugar monitors, strips, and lancets a lot of times are used. And sometimes insulin pumps and the insulin as well during that home health care visit. For those that will need the care of hospice, it will fall under Medicare Part A. It's important to understand when thinking in terms of hospice that the average stay or care for services in the United States is around 77.9 days. See, hospice is designed to cover the end-of-life care and make things as comfortable for someone with prescription drugs for symptom control or pain relief. Hospice can be provided in someone's home or actually at a facility. Medicare Part A will cover all costs for hospice care for an individual if it has been certified that they're terminally ill with a life expectancy of 6 months or less. Hospice starts when agreeing to comfort care. See, the individual must agree to comfort care, which is called palliative care, which means that they're no longer seeking treatment for a cure towards their illness. See, if an individual still requires hospice services after 6 months, they're going to need the doctor or a hospice doctor to confirm that they're still terminally ill for Medicare Part A to continue to cover all of the costs. Medicare Part A will take over for those that are in a Medicare Advantage plan as soon as they've agreed to comfort palliative care and no longer are seeking treatment for a cure towards their illness. So this is the time where someone with a Medicare Advantage plan would automatically go back to Medicare under Medicare Part A if they needed the services of a hospice.